My name's Ryan Howard. I'm an assistant professor of surgery here at the University of Michigan, and I specialize in minimally invasive and bariatric surgery. I'm also the associate program director of our adult bariatric surgery program. I typically see patients in two categories. One are patients with obesity or obesity-associated conditions who are interested in either surgical or medical therapy for weight loss. And then I also see patients with abdominal wall hernias. Good candidates for bariatric surgery are people who have struggled with weight loss or obesity, as well as people who have obesity and its associated conditions, which include diabetes, sleep apnea, heart disease, and a number of other conditions that we know are driven by obesity. Getting a bariatric operation is now on par in terms of safety with getting your gallbladder removed, which is very common. And I think a lot of people don't realize that. They still see it as a very complex, risky operation, but it turns out it's a very safe and effective way to treat weight. I'm also board certified in obesity medicine. And that means that I've had special training in really offering the full spectrum of obesity care to patients. So we know that effective weight loss treatment really requires a comprehensive approach. And that's why, in addition to offering surgery and offering medications, we also connect patients with dietitians to work on healthy eating. We emphasize physical activity and healthy exercise regimens and even behavioral interventions. And so I always make sure the patients understand that there may be more than one option that may be appropriate. And what we're going to do together is decide on the one that makes the most sense for them. So it's really important for me to always let the patient know that I am completely committed to their care and that I'm their partner in their care. Sometimes I deal with conditions that frankly are stigmatized, like obesity, patients who have been dealing with really complex abdominal wall hernias that are impairing their function for years of their life. And I always kind of take us down to a level where I make sure they're comfortable talking about that and they know that they're heard. The way we deliver care at Michigan Medicine is that because it's so team-based, everyone is there on that team with the patient in mind. The patient is the priority, and that informs the way we make decisions and the way we work together. Our bariatric surgery program and our hernia programs are very high volume. We see a lot of patients with a lot of different problems, and I think that just adds to the experience that me and my team have in finding the right solution for a given patient. And the thing I love the most about my job is seeing how proud my patients are about the changes we help them make. In obesity care, helping a patient lose weight that they had struggled to lose throughout their life is just incredible. And seeing them come back healthier, feeling better, and proud for having made those changes, that just makes my day.